We got it.
Beautiful. Thank you.
Yes, thank you. Hello, everyone. Thanks for joining us. I swear I should not be allowed to do anything with technology. My 10-year-old son, I swear, could do a better job than me half the time. But I appreciate you all for being here for our webinar on the truth about testosterone in women. So, we're going to talk about everything that every woman should know when it comes to testosterone. Um, so at the end, we will go through a Q&A. So if you have any questions, there is a Q&A feature here in Zoom, so you can drop your questions in there. And then at the end, I'll take some time to go through and answer any questions that you have. So welcome and thanks for joining us today. So, a little bit about me. If you haven't met me or seen me on our social media, my name is Emily Koska. I'm a nurse practitioner. I joined the practice here at Valley Vital Medicine about a year ago, and I specialize and focus on women's health and hormones. And what really intrigued me in this area was in my previous jobs, I noticed a lot of women in that menopausal age range were really struggling with things like troubles with sleep, fatigue, mood changes, whether it's anxiety, depression, and so many of them were on sleep medications and antidepressants. And I started to realize that maybe there was something else going on here versus us just turning 40 and 50 and now we're depressed and gaining weight and we're not sleeping. So what I have realized is that's that big, huge hormonal shift that's happening that's really contributing to some of these symptoms that women are experiencing. And as a provider, I wanted to do better for my patients and give them options on how to feel better and really thrive midlife and beyond. So my journey in functional medicine has been a long one. I started looking into it when I was pregnant with our oldest child, who is now 10. And so it's been really fun to join a practice where we really take a root cause approach to treating our clients. So when I'm working with my clients on their health and hormones, we're looking at full picture from their sleep, nutrition, their stress, their movement, their environment, which I think is so important to our health. And you'll learn when we talk about hormones that hormones are bullets, but they're not magic bullets. So that means it's not going to cure everything, but it can certainly help, especially when you have a strong foundation. So, working on lifestyle or environment, nutrition or movement is really important. So, some fun facts about me. I love spending time with my family, being outside. I enjoy photography. I've been doing that for over 15 years. I'm a self-proclaimed Harry Potter nerd. I love coffee and a good burrito. So, if you enjoy those things, you're in good company today. So, just a little disclaimer before we really dive in and start talking about testosterone. The information that I'm sharing today is for educational and informational purposes only. It does not substitute as medical, psychological, or nutrition therapy advice. You should always consult your own medical practitioner and seek advice from them about your specific health and your situation. So, a little sneak peek of what we're going to be talking about today. Of course, we're talking about testosterone. So, what is it? How do we make it as women? What can be some of the causes and signs of a testosterone deficiency? What are the benefits of replacing testosterone, and what are your options when it comes to replacement? And then, what are some natural ways that we can support our body in producing some of our own testosterone as well? So make sure you stick it out with us. We're trying to keep it short and sweet today, but sometimes I can get a little winded because I get very passionate about hormones. But if you stick with us until the end, we do have a special offer for any new clients at our practice. So, testosterone. What is it? As women, when we hear the word testosterone, we instinctively think of men. We think of big muscles and a big sex drive, right? Like these gorilla heads. But that is not what testosterone is. In fact, in women, we make testosterone, and over our lifetime, we make more testosterone than we make estrogen. So, testosterone is considered a steroid hormone, and it's part of a group of hormones called androgens, if you've ever heard of that. It's really important to overall health and optimizing our health, especially as we age. In women, testosterone is a precursor for other hormones like estrogen. And having normal or optimal levels are really important to our overall health, longevity, and vitality as women. So, how is it made? We primarily produce testosterone in our ovaries. So, I do start to see testosterone tend to decline in women in their 30s, which is pretty early if you think about it, especially entering into perimenopause and postmenopause. So, a major source of production is going to be the ovaries as well as our adrenal glands. So, our adrenal glands sit on top of our kidneys and produce hormones like DHEA and testosterone. So, even after menopause, as women, when our ovaries stop producing hormones, so it's no longer making testosterone, estrogen, and progesterone, the adrenal glands can kick out a little bit. But in my experience of seeing and treating women in perimenopause and postmenopause, I have not once seen a woman who has optimal or normal levels of testosterone. Every single one of them is deficient and really low, even with production from the adrenal glands. We do get a little bit of production of testosterone in our peripheral tissues. That's conversion from DHEA, which is another really important hormone produced by the adrenal glands. Some of that DHEA will convert into testosterone. DHEA is a very fascinating hormone. It's one that we don't talk about a lot, and I will definitely talk more about it. That might be a future webinar to dive into the benefits of DHEA in women, but that is one that I also see start to steadily decline as we age, especially into our 40s, 50s, and beyond. Um, Biggest changes we see is with aging, but other reasons that our testosterone will start to fluctuate is stress and other chronic diseases. So declining can start as late as or early as our late 20s, but most women I start to see those shifts happening in their 30s. So, what is testosterone? Why is it important? What is its role? Again, most of us women think about testosterone and its role in our sexual function, which, yes, absolutely, it plays a huge role in our libido and sexual function. But there's tons of other important benefits of testosterone. So, it plays a really important role in our energy and supporting mitochondrial function and our metabolism. It plays a role in our mood and stabilizing some of those mood swings that we can start to notice in our 30s, 40s, and beyond. It plays a really important role in our ability to build and maintain our muscle mass. And one that I think is not talked about enough is the importance of our bone density. So, a lot of my ladies who are postmenopausal, testosterone is crucial and an important part of your treatment plan for preventing or reversing osteoporosis. Testosterone also plays a role in our cognitive function. It helps with our memory, mental clarity. So if you're starting to notice some of that brain fog, low energy, low motivation kicking in, that's a decline sometimes in your testosterone. And then the last one that's really important to mention is our metabolism. So, when we have healthy levels of testosterone, we have a healthy metabolism that helps to lower our insulin resistance and improve insulin sensitivity and the metabolism effect. So, again, what can cause testosterone to become deficient? The biggest thing that I see is just a natural part of aging. We steadily start to produce less and less testosterone as we age. Another big killer that I see in my practice is stress. When you're chronically stressed and you have higher levels of cortisol, that does inhibit our production of testosterone in the adrenal glands. So, if you're chronically stressed, absolutely, we can see that start to decline as well. Medications. So, fun fact, birth control pills, when you are on birth control, your testosterone becomes incredibly suppressed. So, if you especially are on any systemic birth control, like oral birth control, the implants or the injections, that will definitely suppress your production of testosterone and kill your libido. Antidepressants are also a big one that are known to decrease testosterone and libido as well. There are certain health conditions that can affect our production of testosterone, like hypothyroidism, which is a thyroid disorder, issues with our adrenal glands, and a big one that I see in my practice is PCOS or polycystic ovarian syndrome. So a lot of individuals, when we talk about PCOS, they assume that women are always high in androgens and have high levels of DHEA and testosterone, when in fact, sometimes I see the opposite in my ladies with PCOS. So not always checking that box. Sometimes that presents different for women. And then the last one would just be lifestyle. Your sleep quality, being very sedentary, poor diet, all of that is going to affect your ability to synthesize and make testosterone in your body. So, what are some of the signs of testosterone deficiency? The biggest ones that I see is fatigue, brain fog, low energy, low motivation. If you think of yourself in your teens and your early 20s, when you had more of that get up and go mentality, more of that sense of vigor, um, that we start to see decline as we age and can be heavily tied into testosterone. We can start to see mood changes. So, new anxiety and depression, irritability starting in our 30s, especially our 40s as we enter perimenopause and postmenopause in our 50s, usually. Libido is a big one. So, with libido, it's not just our desire, but also our ability to become aroused or to orgasm. Muscle weakness and weight gain are big ones. So, we talked about the benefits of testosterone for building and maintaining our muscle mass. In our 40s, every year we age, we lose 1 to 2% of our muscle mass. And a big contributor to that is our decrease in testosterone. So by replacing that, that tends to help us build that muscle back on. So we start to see muscle weakness and weight gain because without muscle, our metabolism will drop. And we talked a little bit about brain function, so brain fog and memory issues. So you might notice that you're starting to have troubles with focusing, you're more forgetful, or you just have that mental fatigue where you feel like you can't last quite as long when we're thinking, especially at work, by the middle end of the day, start to crash. That could certainly be a sign of a testosterone deficiency. So, what are some of the natural ways we can boost testosterone? Now, naturally boosting testosterone is tricky. There's certainly lifestyle changes that we need to make and that need to be the foundation, especially if you're considering going on any sort of hormone replacement therapy. But I just want to share these tips with the caveat that even checking all of these boxes, it's not likely going to get your testosterone into optimal levels, but it will certainly help and you will feel better. So, the biggest things you can do is strength training. So, we need to be doing resistance training. Ideally, if you can lift heavy weights 3 days a week for 30 minutes, that's perfect for helping boost testosterone through building muscle mass. Another one is stress reduction. So many of us women are stressed. So, supporting that, whether it's prioritizing sleep, meditation, journaling, prayers, support groups. There's some key supplements that you can take to really support your adrenal glands when you're chronically stressed. A big one that I've seen success with is ashwagandha rhodiola. Sleep optimization. So many women are not getting enough sleep. A lot of my clients come in averaging like 5 hours of sleep a night. That's not enough. You need at least 7 to 9 hours of sleep a night to really optimize and help your hormone production. Excuse me. Another one would be supplementation. So there are some key minerals that your body needs to be able to synthesize hormones. Those ones would be zinc, iron, and magnesium. A lot of us are deficient because we don't get enough in our diet. So, some sources of zinc would be things like pumpkin seeds, beef, chickpeas. For iron, it's important to focus on red meats, lentils, spinach, and pairing that with a vitamin C for good absorption. For magnesium, you can focus on like your dark green leafy vegetables, nuts, dark chocolates, things like that. Those key minerals will help with synthesis of the testosterone and even DHEA. And then, of course, we want to make sure we have enough healthy fats. Our bodies were designed as women to need healthy fats to, my apologies, produce enough hormones. So, some good sources would be your avocado, olive oils, coconut oils, eggs, and fatty fish. Now we get into the good stuff, which is a lot of my practice and what I do, and that is hormone replacement therapy. So, in my practice, I only use bioidentical hormones. So, what are bioidentical hormones? That essentially means that the hormone that we are replacing has the same molecular structure to what your body has made your entire life. So, it is not synthetic where the structure is altered and it responds differently in the body. A lot of times for testosterone, the bioidentical form is sourced from things like soy and yams, depending where you get it from. But that's typically where we source it from. Now, what are the pros of doing hormone replacement therapy, specifically testosterone? Well, first of all, it's incredibly safe. There are tons of studies, tons of data that support the safety and efficacy of its use. It is a more natural way to balance our hormones. And the nice thing about it is we can really tailor it to the individual and what you need. What could potentially be the cons is yes, we have to monitor your hormones if we decide to go on hormone replacement therapy. There's always a potential for side effects if you go too high on dosing too quickly. Every woman will respond to hormones differently and require different dosages. Some require different application methods. Everyone absorbs and metabolizes it differently. And of course, some women are just not good candidates as well, and we'll talk about what that would be. So, what are some of the different ways that you can replace your testosterone? The biggest ones that I see are creams, pellets, injections, and oral forms. So, in my practice, I would say about 99% of my female clients are on the testosterone cream. So what we do is we have it compounded through a compounding pharmacy. I have them apply it to their labia right before bedtime. Now, the benefit of applying a testosterone cream to the labia is you have a nice thin mucosal layer, so you get really good absorption to boost your blood levels. It also helps for women who are having any of the genital urinary symptoms of menopause, things like bladder leakage, urinary frequency, urgencies, chronic UTIs, and vaginal dryness. So when we apply to the labia, it can help with those symptoms. Your other option would be pellets. So pellets are a procedure that you do in office where they make a tiny incision at the top of your butt cheek and then they insert a pellet that's about the size of a Tic Tac. That pellet with the hormone sits in your fat tissue and dissolves over time. It takes about 3 months or so in a woman for that to steadily release hormone and then need a replacement. Injections. So those would be injections that you do at home. You drop your own testosterone medication and inject it into your thigh or your deltoid twice a week. And then oral would be things like capsules or troches, which basically you put in your mouth and it dissolves. Like I said, in my practice, the majority of the women that I see do really, really well on the creams. It helps with the genitourinary symptoms. We can tailor and change the dosing much easier than you can with like pellets. And also it's much more affordable. I think an important thing to mention also with testosterone replacement therapy is that it is not FDA approved for use in women. So when we are using it in women and prescribing it, we are using it off label, typically for things like mood, fatigue, low libido, things like that. Now, there is a commercially available form of testosterone called Testin gel that you can use, and it is FDA approved for use in men. So some providers will use the gel and then just have women use about a tenth of the dose that a male would use. However, with the gels, we can't apply it to the labia. And absorption sometimes can be an issue when you're applying to places like the wrist, inner upper arm, or the thigh, where the skin is thicker and it's harder to get good absorption. But that is an option, and there are some providers that prefer to use the commercial form. In my practice, I typically use compounded because I know the quality and purity is really good, and I have really good response in my clients as well. So, what would be contraindications of going on testosterone replacement therapy? If you have any hormone responsive cancer, especially breast cancer, that would be a contraindication to going on hormone replacement therapy. So we do recommend that you have your routine mammogram screenings if you are of age. If you are pregnant, you plan on being pregnant or breastfeeding, of course, we do not want to expose your baby or your small child to testosterone. So, if you're a female in your mid 30s and your testosterone is very deficient and you're showing signs of deficiency, but maybe you're breastfeeding or you're holding an infant throughout the day, then those individuals might be a great candidate for things like a pellet or injections where you don't have to worry about exposing them. So that's just something with applications like the cream that you have to be very mindful of. Always washing your hands after applying it and then avoiding contact for 4 hours. When we do the labia application right before bedtime, that does tend to help with reducing that risk of exposure and cross-contamination to others. Now, what are the benefits of testosterone replacement therapy once I get my clients on testosterone and we optimize their levels? Usually, what I see is overall improved sense of well-being. Initially, in the first couple of months, clients will typically first notice better mood, better energy, better motivation. And up to 6 months, we can start to notice more of the sexual function improvement and body composition changes. So, as you're able to build and maintain your muscle more easily, it will over time help your metabolism, which will help you reduce subcutaneous and visceral fat. Then we can start to see more of the body composition changes, which are a great benefit of it. It's also great for our joints and our skin. So, less joint aches and pains, better improvement in your skin, and overall, just better quality of life. So, a couple of things that I also wanted to mention that I know a lot of my clients have questions about is how do we monitor it? How do we know if we need to be on it? So, typically with my clients, what I'm looking at is doing some blood testing. Doing blood testing when you're doing any sort of hormone replacement therapy is gold standard. That is what our data, what our medical literature supports for monitoring your response to hormone replacement therapy. And that's where knowing your values is important. So I do not recommend for any hormone replacement therapy using saliva or urine testing to monitor your response to the therapy and the safety and efficacy of your dosing. So I always start my clients with some comprehensive lab work where we look at their total testosterone, their free testosterone, their sex hormone binding globulin, and their DHEA. So in women, I'm not only looking at their labs to see where numbers are falling, but also their symptoms. So it is important. A lot of these symptoms with testosterone deficiency can overlap with other causes. Adrenal issues, chronic fatigue, thyroid issues. So we want to rule those things out as well. We don't want to assume just because you're 40 and your libido is low and your energy is low that you just need testosterone and that's going to fix all your problems. We want to rule out anything else, anemias, thyroid, other hormonal problems, your adrenals. So doing really comprehensive lab testing is really important, and that's what we do for all of our clients here at Valley Vital Medicine is we want to check off anything else that could be contributing and look at the full picture, not just the testosterone. Um, but if we decide, yes, you're a great candidate, you don't have any contraindications, you're showing signs of deficiencies, your labs are definitely suboptimal, then we start you on replacement therapy. And for my clients, what I typically do is after about 2 months is we repeat that lab work and recheck your testosterone total, free, sex hormone binding globulin, and see how you respond to the therapy and go based off of your symptoms, making sure you're not experiencing any unwanted side effects, and then adjusting your dose from there. Now, that also makes me think about side effects. A lot of women worry about testosterone. I have them come in and they go, oh, well, I heard if I take testosterone, I'm going to grow a penis. No, you're not. That's not going to happen. We have tons and tons and tons of studies. um, and long-term studies about the safety and efficacy of very, very high doses of testosterone in women who are biologically female transitioning to male and how safe it is. Now, when I'm working with my clients, I'm just looking to bring their levels high enough where they feel better and then they have no unwanted side effects. So, if you're working with a provider who's not experienced in hormones and they are essentially dosing you too high, whether it's through a pellet or cream or injection or whatever form, yes, you can experience unwanted side effects such as acne, facial hair, hair thinning, fluid retention, voice changes, and clitoral enlargement. Now, if you're experiencing those side effects, you are way, way, way too high. You are at very supraphysiologic doses. But if you're working with a provider who understands the nuances of hormones, and has had the proper training, what I typically do is I start kind of on a lower standard dosing, and then slowly titrate our way up. And we check in every couple of months to make sure that you're tolerating it, we're not getting side effects. Now, I do have a handful of clients who feel really good on the testosterone. Energy, libido is coming back. They're seeing body composition changes, and they might get a pimple here or there, and they're okay with that. They're completely fine and confident, and I want to keep my testosterone. I'm okay with getting a pimple here or there, or a chin hair here or there, and that's fine. That's incredibly safe. So that's usually it's a shared decision making with my clients on whether or not we keep you at that dose or we lower you back down if those side effects are becoming bothersome, but not a super common complaint in my practice. So I went off on tangents there, but I was thinking of things that I knew you guys would want to know, but it looks like we do have a question. So if you have any questions, feel free to drop them in the Q&A feature here. That's better than the chat. So do you recommend genetic testing to see if you are higher risk for cancer? Also, what about a woman who has not had her uterus or ovaries for 16 years now considering? Those are great questions. So for the genetic testing piece, testosterone specifically, there are oncologists who actually treat breast cancer with testosterone pellets in the breast tissue. In studies, testosterone has been shown to be apoptotic to breast cancer cells, which means it eats them up, gets rid of them, which is very, very fascinating. In the studies, it has been shown to be breast protective. So the sooner you start on it, the better as far as protection. The tricky thing with hormones is, let's say, you are 60 years old and you had a total hysterectomy at 45. You had your uterus out, you had your ovaries out, and you were put into post-surgical menopause. Okay. So your body's not making any hormones anymore, very little testosterone. As soon as you lose those hormones, your risk for chronic disease goes up. So your risk for cardiovascular disease, your risk for osteoporosis, cancers like breast, uterine, ovarian, colorectal cancers, your risk for Alzheimer's dementia starts to go up. So the longer you go without those hormones, the more risk that you would carry to develop those chronic diseases. Now, this is where I go back to the uh, hormones are bullets, but not magic bullets, right? So if you've been without hormones for 16 years, it is possible that you have already started to develop some of those vascular changes or those cellular changes. So the sooner you start, the better. However, just because you've gone 16 years without hormones, that doesn't exclude you from the other benefits that it provides. The only thing is I can't guarantee if I start you on hormones 15 years after menopause that it is going to reverse any cardiovascular disease that has already started. That is going to reverse any Alzheimer's dementia that has already started. Okay. So that's just something to keep in mind. Now, some providers believe that when it comes to hormone replacement therapy, that you should be on the lowest dose for the shortest amount of time. But that is not based on any medical literature. There is no study that proves that. Unfortunately, that guideline came out from the Women's Health Initiative, which was the largest study on women to date. It was a $1 billion study. done over 20 years ago where there was some misrepresentation of the data in the media. And so everyone freaked out. All the women, all the providers stopped taking their hormones because they were telling people that it caused cancer. Now, this study was done with synthetic hormones. It was not done with bioidentical hormones, which is all we prescribe and what I prescribe in my practice. But actually, what they ended up doing was years later, the Women's Health Initiative came back and retracted a ton of their statements and actually said, hormones are protective. Women who started hormone replacement therapy had a 40% reduction in cardiovascular disease, huge reduction in breast cancer and mortality from breast cancer. If you're on hormone replacement therapy and you develop breast cancer later on, it decreases your risk of dying from breast cancer. They saw lower risks of osteoporotic fractures, Alzheimer's, dementia. So tons and tons and tons of benefits and safety. So even if you're 10 years past menopause, yes, there will be benefits. You will have less joint aches and pains. You'll improve your bone health. So we can see when we start people on estradiol and testosterone and progesterone, we can see reversal of their osteoporosis and stronger, better bone. Um, we can also see improvement in any of the genital urinary symptoms that you're having from vaginal dryness, UTIs, vaginal infections, bladder leakage, frequency, urgency, and of course, improvement, hot flashes, night sweats, and all of that. So, tons and tons and tons of benefits for it. Thank you. Thankfully, Manjaro has helped with the risk of heart, but I worry about dementia and bone loss. I was 34 when I had a full hysterectomy, but scared to go on any HRT due to maternal aunt dying from breast cancer and my mom having ovarian cancer. So, the fascinating fact, Amanda, is even with a family history, that is not a contraindication to going on hormone replacement therapy. In fact, you should go on hormone replacement therapy, especially considering that you were put into menopause at 34. Just based on your age alone, your risk for everything significantly jumps. Osteoporosis, cancer, Alzheimer's, dementia, all of it. So the sooner you get on the hormones, the better, especially for you. I would 100% recommend that you consider it. Of course, you want to sit down and have an informed conversation, but your family history is not a contraindication whatsoever to going on hormone replacement therapy. Any other questions on hormones or testosterone specifically from today? Feel free to drop them in here and I'll chat a little bit more about some of the other info we have. So, what do next steps like? If maybe you're listening in today and you're like, okay, yes, 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 I have all the symptoms. I'm in my 40s, I'm postmenopausal. I think my testosterone's deficient. What should I do next? The first thing you could do is book a discovery call with me. So, if you follow the link here on the screen, valleyvitalmedicine.com/call, we can set up a discovery call. This is a 15-minute call where we get to chat a little bit more about what it is that you're hoping to work on with your health. And I can share more about my practice, my approach, what it is that we do here at Valley Vital Medicine. And then you can decide if that sounds like a good fit for you moving forward. And we can discuss next steps from there. Um, like I mentioned before, our clients who are establishing care at our practice come in through what we call our wellness experience. So that includes comprehensive lab testing and then a 90-minute case review with me where we go through your history and review all of that lab work and put together a plan for you moving forward. So if you book a discovery call with me by midnight tomorrow, so that would be Friday, June 6th. If you book your discovery call with me before midnight and note in there that you watched the hormone webinar, we will give you $25 off of the wellness experience as our gift to you for hanging out with me today and joining us. So again, that's valleyvitalmedicine.com/call. And then there should be an area where you can request to do the call with me and an area where you can put in your own notes. And in the notes, just put in hormone webinar and we'll make sure to get you taken care of. Ways that you can stay connected with us here. We are on social media at Valley Vital Medicine. So we're on Instagram and Facebook. We're constantly trying to put out good content for all of you. So follow us there. You can subscribe to our newsletter through the website as well. That's valleyvitalmedicine.com. You can always give us a call. I have my email posted here as well. So thank you so much, you guys, for joining me today. I really hoped that you enjoyed it, and hopefully you can come away with some tangible tips, tools. Always feel free to reach out if you have any questions. Of course, I can't give direct medical advice, but happy to help answer anything that you have for me or help you navigate this interesting system we have here that is healthcare. Carrie, I booked the discovery call when I signed up for this webinar. Can I still get the discount? Absolutely. Um, I will go in because you're probably in our system and I'll make a note on your chart that you did the webinar after this, Carrie. So we'll get you taken care of. Thanks for mentioning that. So thanks again, everyone, for joining us today. I hope you all have a great rest of your day, an awesome summer, and hopefully I will see some of you really soon on my schedule. Bye-bye.